Understanding your prostate biopsy pathology report. My name is Nayak. I'm a urologic oncologist here in Canada, and prostate cancer is extremely common, about 1 in 8 Canadian men. And if you're watching this video, you may have undergone a prostate biopsy and been told that it was positive for prostate cancer, and that could be a pretty scary thing. But I wanted to make this video to really explain the differences and the nuances in prostate cancer, because not all prostate cancer is the same, and it's very important to understand your pathology report when you're making decisions that impact your life, because decision regret, meaning regretting the decision you chose to treat your prostate cancer, is a real thing. And prostate cancer is different than other cancers because you do have options, and that's why it's very important for you to understand exactly what you have so that you can make the decisions that best align with your values and your preferences. So when it comes to the actual biopsy report, every time a sample was taken, you may have felt a snapping sound, and each one of those samples was analyzed individually. Sometimes all of the samples have cancer, and sometimes only one of them have cancer. And so that's one variable that we look at as well. How much cancer is there? But if the pathologists actually identify prostate cancer in a given sample, they zoom in on that sample and they assign it a score that we call the Gleason score. The Gleason score categories can be the numbers 3, 4, or 5. The pattern 3 prostate cancer is very low grade. It's almost looking like normal cells actually. So it's actually not that bad. Whereas a pattern 5 cancer can be a lot more serious and has a lot more potential for causing problems. But the pathologists don't take it easy on us. They actually make it a little bit more complicated because they assign 2 numbers to any positive biopsy. But those 2 numbers have to include the numbers 3, 4, or 5. And all that it represents is the most common pattern followed by the second most common pattern in that given sample. And they write it like a math equation, A plus B. The A is the most common pattern they see, and the B is the second most common pattern. So the lowest type of prostate cancer that anyone can have would be a Gleason 3 plus 3 equals 6 prostate cancer. The highest would be a 5 plus 5 equals 10 prostate cancer. You can have any mix in between. So if the total score adds up to 6, that would be low grade or low risk prostate cancer. If the total adds up to 7, whether that's a 3 plus 4 or a 4 plus 3, that'd be intermediate risk. But if the total adds up to 8 or more, that would be high risk prostate cancer. While it's important that you still have a discussion with your urologist or your treating provider regarding these results to find out what's the best treatment for you and what's the best approach, keep in mind that not all prostate cancer is the same, and things like low risk prostate cancer can actually be left alone without requiring any treatment at all. So hopefully this gives you a little bit more background information onto the severity of prostate cancer and how we decide who needs treatment. And stay tuned for our next video where we'll actually get into the various treatments for prostate cancer as well as the pros and cons of all of these options. If you have any questions that you've thought of, other people are probably thinking of them too. So leave a comment for us and we'll try to answer your questions the best that we can.